Welcome to Advanced Regen Medical Lifestyle Series. In this video, we will talk about tips on helping you have healthier everyday habits that can reduce your symptoms and help you with your pain. Our patients with chronic illnesses usually have autoimmune diseases or other things that can cause their illnesses to be exacerbated. We will talk about ways to lose weight by managing sugar intake and specific diets catered to less sugar, which help you improve your overall health. Before we begin, we do want to mention that it is important to consult with your primary care provider before starting any diet or weight loss program. There are many long-term healthy habits that can be beneficial to your physical health. One would be your diet. Your diet plays a major role in your overall health and well-being. The foods you choose to consume are crucial in obtaining the necessary nutrients and vitamins your body requires to function at its best. The glycemic index is one great tool that can assist you in choosing the right foods. This tool can help you regulate your blood sugar and reduce the risks of prediabetes and diabetes. Low glycemic index foods contain slower-acting good carbs that slowly enter your bloodstream and prevent large spikes in blood sugar levels. On the other hand, higher glycemic index foods contain faster-acting bad carbs that quickly enter your bloodstream and create large spikes in blood sugar. By avoiding high glycemic index foods, you will experience the positive benefits of managing your blood sugar levels, weight loss, and delay of feelings of hunger. Common high glycemic index foods to avoid are white rice, white bread, pasta, and sweets such as pastries, ice cream, candy, and cookies. A diet full of foods rich in fats, proteins, and fibers will have a lower glycemic index. This includes foods such as fish, meat, eggs, non-starchy vegetables, and nuts. If you are unsure about the glycemic index rating of a certain food, you can easily search the web to do so. Restricting carbohydrates is a useful method to aid with weight loss and develop healthier eating habits as well. Cutting down on carbohydrates can help with weight loss as it slowly forces your body into a fat-burning mode. As you consume less carbohydrates, your body will burn through its stores of saved carbohydrates. When the stores are depleted, your body will begin to burn fat for energy. Less carbohydrates also mean less sugar within the body. A lower sugar intake will decrease the risks of becoming diabetic or pre-diabetic, as insulin resistance will be less likely. Keep in mind, a low-carb diet that is plentiful of healthy fats, proteins, and vegetables can lower your risk of diabetes. Another method to assist you with healthy food choices and creating a better diet is intermittent fasting. Intermittent fasting assists with chronic illnesses, such as neurodegenerative diseases, diabetes, and can reduce inflammation. Intermittent fasting converts your body into a fat-burning mode to aid in weight loss and gives your digestive system a break. In an intermittent fasting plan, you will switch between days of limited caloric intake and days of eating normally. For example, the 4-day intermittent fasting plan requires that you fast for 4 consecutive days within the week. On the days that you fast, you will reduce your calories down to 500 calories. For the remaining 3 days in the week, you can eat as you normally would. This type of fasting allows for your body to use up stored fats and run on ketones for energy. This way, you may experience increased energy levels and mental capabilities. Overall, cutting down the number of calories you consume may keep your heart healthy. Better heart health can reduce risks of heart disease and strokes. Recording food intake can help with weight loss by tracking the number of calories consumed per day. You can calorie count by looking at the nutritional facts label of the foods you consume. Many restaurants also offer nutritional information on their menus, where the total calories are listed as well. You can use an online weight loss calorie calculator that factors in your age, height, weight, and activity level to determine the number of calories needed for weight loss. A good online site to use is healthline.com's calorie calculator. Remember, counting the calories of the foods you eat can help in consuming fewer calories and keep your heart healthy. Another long-term healthy habit that could be beneficial to your physical health would be exercise. Strength and endurance exercises are key factors that promote long-term health and contribute to healthy lifestyle choices. Cardiovascular exercise can boost your metabolism and contribute to weight loss by helping to burn calories and aid in suppressing appetite post-workout. Daily physical activity can contribute to lower blood pressure, stronger bones, and stronger immune function. A few examples would be running, swimming, aerobics, walking, gardening, and resistance training. How does exercising regularly help your body? It can help your mental clarity, give you better sleep, improve your complexion, strengthen your muscle, lower your heart rate, contribute to weight loss, give you stronger bones, improve your immune function, and lower your blood pressure. Daily physical activity brings all of these health benefits that contribute to your overall well-being. Another long-term healthy habit to keep in mind is autoimmune sensitivities. In autoimmune conditions, your body may be suffering from inflammation that is due to hidden food sensitivities. This inflammation may make it difficult to lose weight. You can pay close attention to a specific food and eliminate each food group to determine if it may trigger your inflammation. Some examples would be gluten, dairy, and caffeine. Cutting out certain foods, such as gluten, can limit the inflammation that is associated with foods that may be autoimmune triggers. Let's take a closer look at gluten, for example. What is gluten? Gluten is the sticky substance found in certain grains and adds much of the texture in baked goods. Unfortunately, it contains a very powerful protein that disrupts our immune systems. Clinical testing indicated that as much as 70% of our population has adverse effects when eating these molecules. Why go gluten-free? Gluten can generate and stimulate our immune response to mistakenly attack important tissues like nerves, bones, glands, and organs. Nerve diseases can be autoimmune related when antibodies attack our own nerves. What does this mean to you? You will benefit from substituting wheat-based foods like bread, pasta, cereal, and crackers with similar foods made with substitute sources: rice, quinoa, teff, amaranth, chickpea, coconut, and nut flours like almond. Many of these are readily available in pre-packaged foods. Common sources of gluten are wheat, rye, barley, spelt, kamut, oats, couscous, and bulgur. When going gluten-free, avoid wheat-based flours, pastas, and breads. Regular oats may be cross-contaminated and not considered gluten-free. Instead, opt for substitutes made from gluten-free oats, oat flour, rice, almond meal, quinoa, and corn. An important process of going gluten-free is to read your labels. 1. Your refrigerator and pantry. Go through everything and throw out anything that contains wheat. 2. For shopping, read the labels and avoid items that list wheat or wheat gluten. And 3. For nutrition, substitute non-gluten grains into your diet. We do want to mention, as you eliminate gluten, your system becomes more sensitive to gluten exposure, and you must get more precise in the selection of your foods and supplies. These are just a few of many tips that can be beneficial to your physical health, reduce your symptoms, and help you with your pain. It's important to consult with your primary care provider before starting any diet or weight loss plan.